Think we're right at 8:40. I think we can go and get started. Good morning, everyone. My name is Eddie Hahn, and I'm a director with Jabian Consulting, and I'm incredibly excited to be here with you all this morning. Today, I have the pleasure of introducing our first speaker of the day, Lieutenant Governor for the state of Georgia, Jeff Duncan. He's going to be speaking to us about a very important topic in health innovation and partnerships. Really, over the course of this year, Jabian Consulting has had the honor to support the Georgia Innovates Task Force, which was formed by Lieutenant Governor Jeff Duncan to position Georgia as the technology capital of the East Coast. And this task force was extremely successful in producing bold ideas that culminated in a roadmap of innovation recommendations across all sectors of our economy, including healthcare. And really just knowing the collaborative mission that Health Connect South has, in addition to the sophisticated healthcare-focused leaders that are really engaged with this organization, we couldn't imagine a more appropriate venue to have Lieutenant Governor talk about his vision for health innovation and partnerships in the state of Georgia. I'm sure many of you know Lieutenant Governor Jeff Duncan. He's originally from Alpharetta, Georgia, and was a scholarship pitcher at Georgia Tech and was drafted by the Florida Marlins organization. Upon retirement from baseball, he and his wife, Brooke, started a small marketing firm. After great success with that business, they sold the company and proceeded to move on to other entrepreneurial ventures. And Jeff Duncan later became CEO for Wellview Health, which is a healthcare and wellness company. In 2012, Jeff decided to pursue a career in politics and was elected to the Georgia House of Representatives. And in 2019, he was inaugurated Lieutenant Governor. Lieutenant Governor, I'll now hand it over to you. It's an honor to have you here with us this morning. Thanks so much for joining us.
Well, Eddie, thank you so much for the opportunity, and personally want to thank Jabian for their help along the way on our task force and so many other key partners all across the state who've helped us really execute on this vision of trying to become the technology capital of the East Coast. This is a fantastic platform. Health Connect South is just full of talented individuals who tackle the same issues that I do, both as I did in the private sector and also as an innovator in the government space and as a leader in the state. So thanks for this opportunity to address just an incredibly talented group of individuals. So you got to go back to this whole notion of wanting to become the technology capital of the East Coast. And it really started on the campaign trail, and it really was my version of what economic development needed to look like. It was my recipe for strong growth, sustainable growth here in Georgia. Too often we watch these one-hit wonders show up, a small business or an industry, and it's just one small business or one industry, and really it lacks the ability to grow in more of a kind of exponential format. And that's because I think that the ecosystem around it maybe doesn't exist. And so becoming the technology capital of the East Coast was my idea of saying, look, every single business in the country, in the world for that matter, is a technology company, right? Whether it be Coca-Cola trying to figure out how to deliver millions of bottles of soft drinks a day, Delta Airlines, or a small lawnmower shop in the suburbs. They're trying to find their next customer with social media and data mining. And so every business is a technology company at heart these days. And so how do we make sure that we develop a consistent flow of talented individuals to show up in a K through 12 system, in a technical school system, in a four-year education system? How do we entice investment to come in? How do we entice regulations or create an environment where regulations aren't burdensome, but they're inviting to that small entrepreneur that's trying to get started? And so really what started as a campaign speech really then started to migrate into this notion of how do we become, what are the actionable steps that we can take? And we started the Georgia Innovates Task Force with the leadership of Bud Peterson and Johnny Isaacson and so many others that helped us really pull together, what does that plan look like? And so what that plan, after a year's worth of work, what that plan now looks like is a group called PI2, Partnership for Inclusive Innovation. And what we've done is created a group of individuals that are extremely talented from all across the state, from all across different industries, that are essentially my board of directors, along with Bud Peterson, who's chairing the group, Deborah Lamb's our executive director, and we're working together to find ways that we can take on some of the toughest challenges we have, right? We've got this notion of building pilot programs with a public-private partnership. We've got an in-kind contribution from Georgia Tech and their administrative services. We have an incredibly grateful group of private sector individuals that have stepped up to the plate in a big way, and the state is putting in a few dollars also to help us get these pilot programs up and scaled. Now, it's important because this is a healthcare conversation to understand health technology is right in the crosshairs of all innovation, as I understand, the way I look at it. Everything hinges on health and innovation around the state. It's a complete story. It's not just an Atlanta story. It's a Georgia story. And health technology is one of those areas now, especially in this COVID-related time. COVID, not only have we had to have, increased therapies and attention and research and data analysis and all that around COVID, we've also had to figure out how to deliver healthcare in a totally different format than we ever have before. A good friend of mine who's actually on this call with a company called ExamMed made a point early on in this crisis. He said, our business model accelerated 5 years in 5 weeks in a telehealth model. And that's just because of that notion that everybody has to understand that we're going to deliver healthcare in a completely new way, whether that be primary care, specialized care, follow-up, chronic conditions. It doesn't matter. All questions around healthcare as we move forward. So what we want to do here is become this centered hub. We want the world to pay attention to who we are. We want the world to be comfortable to invest here in Georgia. We want that 5-person startup to become that 500-person unicorn. We want that 5-person startup on the West Coast to want to come to Georgia because it's a great place to find talented individuals that understand a 21st century global economy, that they've come through a K-12 system that's got them prepared. They've gone through a technical school or a 4-year program that's got them ready to take the next step in solving the world's problems. This is really, truly an incredible period of time. We as entrepreneurs, and I would imagine almost everybody on this call is an entrepreneur in one way, shape, or form. You're a maverick in your space, understands that with disruption, and certainly COVID has created a disruption, comes opportunities. And so I think it needs to be a continued cycle through of us looking every minute of every day for new opportunities to try to gain ground. I'm so excited about PI2. I'm so excited about really building this ecosystem, and really it dovetails well with the Health Connect South mission of really trying to create this ecosystem and platform for sharing information, for sharing relationships, for being extremely collaborative. And that's really what we're seeing, even the early signs of it. We're excited about where we're headed. Certainly a lot of work to still do. We've got 3 years, and certainly we're going to try to take on some of the biggest, most robust challenges out there across our great state. It's important to take 1 second to dissect the PI, Partnership for Inclusive Innovation. And, partnership is truly that. It's a collaborative public-private partnership that gathers the wealth and not the wealth of knowledge from those individuals that are a part of our board, but also because of their relationships out in all areas of the state. Inclusive means a million things, a million times a second. Inclusive means crossing boundaries. It means being invitive to all those folks around, whether it be rural, metro, wealthy communities, struggling industries, race relations, all of that. It's just we want to be as inclusive as we can, because the more inclusive an organization is, the better perspective they have. And that's truly been the way I've operated as a leader in the private sector, and certainly the way I approach this here in my role as Lieutenant Governor. So it's incredibly honored to be able to just share a few thoughts of mine and kind of the direction we're headed. I think we've got a great future in front of us here in Georgia, and there's 2 things to remember. This is as you're trying to scale your business, as you're trying to grow your footprint. Georgia is a great place to run your business, and we have all the professional accolades to tell us that. But 2, this is a great place to raise your family, and we can never forget the value of doing that. As entrepreneurs are typically young, but now we're seeing folks all across the age spectrum. Raising your family and having a great place to educate your kids and a great way of life is something that's important and invitive too, and it's something that we fight hard for every day here in this role. So thanks for the opportunity to address you. Thanks for all the jobs you're creating, all the problems you're solving, all of the great relationships that you're building all across the great state. And certainly it's an honor to be in this role.
Excellent. Thanks so much, Lieutenant Governor. Just hearing about the concept around public-private partnerships, and then the pilots that are ongoing and the scale that we're aiming for, I think it's really exciting and inspiring to the group here. As part of our segment this morning, we thought it'd be good to also spend a few minutes to hone in on a few areas that the audience might be interested in hearing more about. So we've pulled together some questions we'd love to get your take on, if that's okay with you.
Yeah,
awesome.
Absolutely.
As you talked about, right? I mean, a lot of the recommendations that came out of the task force are intended to remove barriers to participation by providing access and opportunity for all Georgians through the inclusive innovation piece. These recommendations all sectors of our economy, like you talked about. Was wondering which of the recommendations directly impact healthcare and health outcomes for the state of Georgia? And for our audience of healthcare leaders, what can they really do to make it successful?
So, look, this is going to be a massive effort over time. We're going to build these pilot programs up, stand them up, and really with the understanding that we're going to quickly scale them for the most efficient cost we can, and then understand, are we solving big problems? Are we just tackling little nuances, or are we tackling big problems? And so on the health, I think one of the first things that we need to be able to take on is from a rural broadband perspective, is making sure we drive broadband as far into our rural areas as we possibly can, so that we can deliver strong quality healthcare, so that we don't have to have two healthcare systems, one for those that have access to broadband and one that doesn't. We certainly want to be able to blend those together. Look, this is a difficult solution, a difficult situation, right? We've seen this play out at the Capitol in my 5 years as a state rep, and now in my second year as lieutenant governor. It's hard to make a business case to run fiber down a dirt road to go to five homes. But certainly I think technology is working in our favor and looking for new, innovative, less costly ways to deliver that. I also think in the healthcare space, we can make great strides in creating platforms to share data. I think that instead of data being in silos, we all know that in our businesses, even inside of a small organization, data is, for whatever reason, is kept in silos. But we know the actionable steps, or the actionable mapping that we can put forward if we can share data. And so really trying to build out pilots around putting that on display for both the private and the academia and the healthcare sector to be able to understand and have confidence around that as we move forward. Because data is critical to everything that we're doing and the way we analyze that. We certainly are watching that play out in COVID and just the grasping at straws to start this process of the pandemic.
Absolutely. No, you bring up a great point, and I know a lot of leaders on this call are very focused on that challenge as well and have some creative ideas on how to address that. So thank you for that. The next question is just around Georgia's rich history of collaboration, as you know, and really, Health Connect South, as you mentioned, serves as a platform to promote that regional health collaboration, not only in Georgia, but also across the southeastern U.S. Can you share a success story or two that really exemplify the value of the collaboration and how it has led to successful innovation?
Well, I think there's a number of them. I think one is watching our higher eds, our university systems really work together with the private sector. If I watch how Georgia Tech has built an incredible relationship with the private sector, Bud Peterson was a great steward of that early on, and now Angel Cabrera continues to carry on that great work that they're doing. I think it's an incredibly powerful intersection. You've got the power, you've got the academia strength of an institution, and then to build the trust from the private sector who brings those problems in, whether it be devices, whether it be software development, hardware development, all of those things in and around healthcare specifically, and then to watch investment flow in, and then to have an exit strategy out of it to go commercialize the concept. And so for me, that's probably, without laser focusing in on one specific issue, I think there's a ton of confidence that's built. And what you watch is these organizations inside of our universities, and this isn't just a Georgia thing, this is all over the country, but to watch the success, when somebody tastes success, they keep coming back and coming back and coming back and coming back, and continue to bring those challenges and continue to see those opportunities. I think it works well. It works well here in Georgia. And once again, PI2 has got, our partnership is with Georgia Tech and others. This is not just a Georgia Tech story. This is certainly, we're going to work with the University of Georgia and all other schools as we tackle big issues like ag and cyber and fintech and all these other challenges that are out there. Absolutely. Definitely a statewide initiative. And I think the impacts are far reaching across the Southeast. So that's great. In terms of sustainability, I know that's really a focal point. How do we both ensure both the impact and the value of the Georgia Innovates Task Force is sustainable over the long term? Yeah, look, that's a challenge, right? Is just being perfectly honest. The government isn't typically good at being able to keep things going, for a long time. We're the Governor Kemp and myself are trying to kind of change the trajectory of that. Certainly in my time here, I've only created 2 task forces. One was last year that we tackled healthcare specifically and looking for ways to create more efficient, effective healthcare. And we had a number of quality pieces of legislation that come out of that this past year. This task force, Georgia Innovates Task Force, created PI2, and we'll set up metrics, right? It's hard to put your finger on the exact pulse of how much investment's flowing in, how much improved digital readiness is in our K through 12 system, how much more dovetailed our higher ed system is to the private sector. But certainly one of the things that we can feel, and it's an ecosystem. Eddie, if we're successful at this, everybody in every corner of the state's going to feel the ecosystem building. Somebody asked me a few weeks ago, what's the headline going to say in 5 years about this whole effort of becoming the technology capital of the East Coast? And my answer it was kind of an off-the-cuff answer, but it ended up miraculously being a good one, was the headline says everybody in Georgia can be an entrepreneur. That's really the mentality that we want. We want that young kid who's dreaming about being a programmer or being a game designer or being a doctor or being whatever their passion is. They should have an opportunity to do that here in Georgia.
Excellent. Well, no, I appreciate that. And, one of our questions was also around some of the milestones, which I think you just hit on. So, certainly agree that the sustainability piece over the next 3 to 5 years is critical, and that's going to be our ultimate goal.
Yeah, and Eddie, one other thing, the board that we've built, these are Paul Bowers, Raphael Bostic, Paul Judge, Carol Tomei. I could go on and on and on. There's a whole just incredibly gifted list of big business leaders. These folks are used to building metrics that matter, and so that's really what we're going to lean in as we develop this board, is really getting their input to build the metrics to help us be successful and to help us make course adjustments as we go through this.
Excellent. That's and very, very relevant and exciting. And I think, like we talked about, those key metrics, those milestones are going to be top of mind for us in the near term. Our last question is really just around your track record. I know that really before joining politics, you've had a great track record as an entrepreneur and business leader in healthcare specifically. And based on just your experience and what you've seen in business and now in politics, for our audience here, was wondering what advice can you offer to our audience of healthcare leaders to really turn their healthcare vision and dreams into reality?
Yeah, it's a loaded question because look, I love the private sector. I didn't get into politics because I wasn't comfortable going to work every day. It's been a faith mission for my wife and I, and we wrap ourselves around this notion of policy over politics. And it specifically means a lot to healthcare, maybe more so to healthcare than any other space. We've watched over the last 2 years, we've signed the governor, and he reminded me of this the other day when we did a ribbon cutting down in Columbus for Mercer's 3rd medical school, was he signed 40 healthcare bills in the last 2 sessions, okay, 40. And many of those started in the Senate, because healthcare is one of those things we cannot play politics on healthcare. It's too important. For way too long, we've tried to make healthcare policy decisions based in partisan corners. That's an invalid way to solve the problems that we face in healthcare. Healthcare solutions are found in the middle. They're found wrapped around good substantive policy. They're wrapped around innovation. They're wrapped around investment. They're wrapped around community development. Those things have nothing to do with party, has nothing to do with partisanship. And so my encouragement to everybody here is don't get sucked into the vortex of playing politics around healthcare. Go keep doing what you do well. Go keep tackling the challenges that you face. Go keep being a better organization. Keep growing. Keep seeking investment. Keep seeking input. Keep creating the product flow. Just be who you are and don't get sucked into the trappings of politics. Because really, I don't think there's any solutions found in politics when it comes to healthcare. Certainly, there's only, we can agree on 2 things. And I diffuse any room I walk into, whether it's my party or another party or in between or who knows. Say, look, we all agree on 2 things about healthcare. We want better access, more affordable healthcare. Those 2 things. Those are bipartisan things that we can all tackle. And I can assure you that if what you're working on and what business you're building around healthcare does that, then you're going to be successful. And that will continue to put us in a great light here in Georgia and continue to allow us to become the technology capital of the East Coast.
Excellent. No, I couldn't agree more. And, Lieutenant Governor, really appreciate you sharing not only your vision, but also addressing some of these questions. I can already tell in the chat that there's a lot of excitement around the recommendations, the pilots, and all the work that's going on. And a lot of folks are asking about where they can learn more. So we'll point them in the right direction. And we thank you for your time.
Thank you so much for the opportunity. Thank you to Health Connect South and your great mission and platform. and all the great partners that are continuing to help us do the things that we need to do here in Georgia to keep this ball rolling.
Excellent. All right. Well, thank you very much, everyone. That wraps up our time, and appreciate it.